Hi, I'm Sia Daneshmand. I'm a professor of urology and medical oncology at USC, Norris Comprehensive Cancer Center, and I'm very pleased to be having this conversation with Joe Jacob. And we're going to be talking about the recent results that was published regarding SunRISe-1 trial, the TAR-200 device. So, Joe, thank you for joining me in this conversation. And as an active participant in not only this trial, but also the other Sunrise trials, I think you not only have a lot of experience, but also a lot of insight into obviously the disease space and how this works. So, congratulations, you're a co-author on this paper. I think it's getting a lot of attention, and I'm really pleased that all these years of hard work have come to fruition.
Yeah, absolutely. Thanks for having me, and congratulations to you, the first author on the JCO paper. It's a great accomplishment.
Thank you, Joe. Thank you. So, as you know, this was initially called the GEMRIS device. This was 2016 when we did the phase 1 trials. And it was a window of opportunity trial where we were placing this right before radical cystectomy. There were two cycles, so to speak. We would put it in, remove it at 2 weeks, and then a week later put in another one, and then remove it just before the cystectomy. And it was just a safety and feasibility. A, it was found to be very feasible, and two, side effect profiles were very favorable. And more importantly, we saw some activity there. These are patients who had muscle-invasive bladder cancer and were going for a radical cystectomy, who were cis ineligible, were not receiving neoadjuvant chemotherapy ahead of time. So we saw activity there, and with visible tumor, we were going in every 2 weeks, visible tumors actually regressing, getting smaller. We had some PT zero. So this was how this whole concept started. And of course, the four Sunrise trials almost started, immediately as Johnson and Johnson acquired the device. So tell me a little bit about your experience. There was a gap between our phase 1 and this phase 2b trial with SunRISe-1. How easy was it to talk to the patients, to do the device insertions and removals? I know what my experience was, but I'd love to hear how it was for you.
Sure. You know, I remember the first time I placed this device, everybody was a little bit nervous. It really is like when you step back and take a look at it, it's really the first time we've really put a device in a bladder. I mean, if you think of it just from that standpoint, it's kind of amazing. But I was surprised how easy it was. I mean, urologists designed this catheter. Catheter was perfectly sized, shaped, and it just went well. And everyone was like, "That's it." And I was like, "Yeah, I guess that's it." So
I've
it
heard
was
that a
kind of
lot.
fun. Yeah,
I've heard that a lot. Is that it?
yeah, yeah. It was, it's one of those things where you think about it, you talk about it, but when you're actually doing it, it's about a 10-second procedure, not even a procedure, I would say just a 10-second like catheter placement. So that was like my initial experience with it. And then pretty soon after that, patients were asking, at some point during the trials, patients were actually asking for it. When they heard that, this was a sustained release device, this was a device where they, only had to come in every 3 weeks instead of every week. And people started hearing about the results as well. And so it wasn't really anything that I had to sell or convince patients. I honestly found that most patients were really sort of excited and almost pushing me. I actually had some patients, um, try to contact me from out of town and say, "Hey, do you have the trials, still open?" And so I almost found that patients were pursuing me. And now the other thing I would say about this is, pretty soon I got busy, and my nurse practitioner started taking over, placing these devices, and it was very easy for her to, just kind of take over that part of it.
That's a really important point that you bring up because the notion is that this is a procedure and it's going to take up our time, whereas other intravesical treatments are given by the physician extenders. But as you mentioned, your physician extender and nurse practitioner is helping with the both placement and removal for those extenders who do procedures in the clinic. So it's not difficult. Anyone who does stent removals is basically identical procedure, right? For the removal, and insertions are as easy as catheter placement, and very few nuances to it.